Hello, I'm happy to have the opportunity to speak with you about our caregiver program. I'm Dr. Jennifer Davis. I'm Associate Professor at Brown University, and I've worked as a clinical neuropsychologist at Rhode Island Hospital for the past 15 years evaluating patients with Alzheimer's disease and other forms of dementia. In that work, I have interacted with hundreds of families who are dealing with dementia. In collaboration with my colleagues, we developed a program to help caregivers cope with a range of stressors that can come with this disease. We learned that it is very important to help caregivers shift their focus from their loved ones to themselves. Toward this end, we developed a program to teach caregivers, like yourself, new problem solving. Our goal is to help you remain a healthy caregiver. So let's start there. Why is it important to shift the focus to you? You may notice that friends and family ask how your loved one is doing, but may not ask you. And I've also noticed that caregivers do the same. They rarely talk about themselves, and they often neglect their own needs and health when providing care for their loved one. One of the major goals of this program is to help you evaluate, monitor, and address areas of your life that we know are important to you and your well-being. The second goal is to teach you a problem-solving method or strategy to apply to your own caregiving situation. Every caregiver situation is different from another's, and we understand that. But we know that we can tackle a variety of situations with a set of strategies that can reduce or resolve the problem and lower your stress level. If chronic stress is not reduced, you may become sick, you may experience depression or anxiety symptoms, and you may even feel as if your own memory is failing. We're hoping that as you participate in this program, we can minimize some of those effects. So let's talk about the model you'll be learning to use. The main framework we're going to use is called the Stress and Coping Model. We understand that caregiving is stressful, and we can't completely avoid stress. And I want to emphasize that point. We understand that we can't completely avoid or eliminate stress. The idea, rather, is to think about stress differently, or how to appraise or evaluate the situation, and to rely on new tools to help with coping. So let's talk about how this works. As you know, the diagnosis of dementia itself is a stressor. There are declines in memory and thinking that may start to impact the person's ability to engage in their regular activities. You are required to take on more and more duties that you may never have had to do. And there are major role changes in the family. There may even be behavior problems that impact how you communicate with each other and how you communicate with extended family and friends. There are endless examples of changes that happen slowly over time. And there are two possible responses to these situations. One response is, I'm not concerned with the problem, so I don't feel stressed. And that's okay, that's one option, because some problems don't reach the threshold of being something that we need to really focus on. The second response is more typical though, and it is, I'm overwhelmed, and I don't know what to do or how to handle this situation. That is when we feel stress. The way you initially look at the problem is called a primary appraisal. That is how you evaluate or assess the situation. So you're initially assessing, is this a stress or a threat or not? If it is a stress becomes an uncomfortable feeling and can cause physical health symptoms. It can impact your sleep and mood and thinking skills. So the idea in this program is to change how you initially think about or how you look at the problem and how you evaluate different caregiving problems or situations. This is where we will focus our work. We will practice making a secondary appraisal. It's a secondary evaluation. So one possibility is that you continue to feel as if you don't know what to do or you don't have the education or resources to tackle the problem. This will lead to negative stress, and some of you may be experiencing that. This type of stress is not good for your health. What we hope to do is instead give you the tools so that you feel that you have the resources to cope. You may still experience some stress, but we think about this as positive stress. This is a stress you feel when you are actively engaged in solving a problem and feel that you have the resources to address it. This differs from negative stress, in which you may feel helpless or hopeless. Positive stress does not have the same impact on your health as negative stress. So, as you explore the app and use this program, we will attempt to increase your coping resources through education, self-monitoring of key areas, things like your health, your mood, your social support system, and how your family's functioning. And we hope to convert negative stress into positive stress. So this is just a basic overview of some of the principles guiding our program. You will have the opportunity to learn more about dementia and to develop a systematic approach to identifying and breaking down a particular caregiving problem in the education section of the app. We hope you can involve your family in this process and identify important resources to support you in your caregiving journey. It will be important to identify both instrumental resources, that is things like physical supports, maybe nursing care or participation in a day program. But it is also important to identify emotional supports, people who can help you along the way, to whom you can ventilate and gain emotional support. So I appreciate your attention and listening to this introduction, and I hope you enjoy the CAREWell program.